day, ma'am. I am Angeline Reyes, your student nurse from Pamantasan ng Lungsod ng Marikina, and I will be going to demonstrate to you a intradermal injection for skin test. So the importance of this procedure is to know if the patient have allergy to the medication. And then next is you need to verify the doctor's order to avoid mistakes in whether in administering medication or in such doing skin test to your patient. And then before entering the patient's room, you need to perform hand washing technique to prevent the spreading of microorganism and to avoid cross contamination to your between you and your patient. So, good day, sir. I am Angeline Reyes, your student nurse. And then, what is your name?
I am Noel Brigaudi.
Okay, and then what is the date of your birth?
September 19, 1996.
So, sir, is it okay to you if I will close the curtain so that you will have privacy?
Yes, it's
So, excuse me, I will close the curtain. Sir, I will be doing a skin test to you. So let me know if you feel uncomfortable and tell me if you were ready.
I'm ready.
Before doing a procedure, you need to gather all things that you will be needing. The distilled water, the clean gloves, the syringe, the cotton balls with alcohol, and then inspect the site where you will inject the fluid. It should be not inflamed, and then no lesion, because lesion can add more pain to the patient when you inject the fluid. So wear a clean gloves again to avoid spreading of microorganisms. And then clean the site where you will inject the fluid. It should be in circular motion from the center, widening outward, because it can allow the dirt to go outward or away. And then prepare the medication from whether it from vials or ampule. And then next is you need to prepare the injection the syringe that you will inject to your patient. So add air to the bottle of the sterile water to withdraw a fluid. In getting a syringe, you need to hold it using your thumb and your forehand. And then next is you need to expel the bubbles on the syringe by simply tapping the syringe. And then gently push the plunger to expel the air and the bubbles and to remove the excess water on the syringe. And then before injecting the fluid, you need to dry the surface that you will inject or where you will inject the fluid, because alcohol can cause more pain to the patient. And then next is you need to stretch the skin and with the needle pointing almost parallel to the skin surface. So inject the needle to the skin far enough the bevel. It should be from epidermis to dermis. And then gently push the plunger to inject the fluid. And then withdraw the needle carefully. And then cup the syringe. And then discard it to the sharp container. And then if the skin has a blood, just simply wipe it on the edge of the cotton and then discard it. So you need to mark where you inject the fluid for monitoring. And then after 15 minutes, you need to check if there is a swelling or if it is inflamed. And then next is you need to aftercare the things that you have used and then document all the data that you have gathered and the procedure that you have done. That's all.